How to care for yourself during head and neck radiation. Your registered dietitian will help you with your eating and drinking. If you are having trouble eating or keeping your weight the same, tell your healthcare team right away. Choose high-protein, high-calorie foods and fluids like cheese, milk, meat, eggs, beans, Greek yogurt, puddings, or ice cream. If you are having pain or trouble chewing or swallowing regular texture foods, choose soft, moist, or blended foods. You can add sauces, gravies, oils, or butter to help moisten your food. Avoid acidic foods and fluids like tomatoes and orange or grapefruit juice. Avoid hot beverages. Avoid dry, hard, crusty foods like toast, nuts, popcorn, and raw fruits and vegetables. Eat many small meals or snacks during the day when eating becomes more difficult. Take nutrition supplements and/or smoothies or milkshakes. Aim to drink 8 cups of non-carbonated alcohol and caffeine-free fluid every day. Take small bites of food and sips of fluid often to keep your swallowing muscles working. Taste change is normal. Ask your registered dietitian for tips to help make food taste better. Your speech-language pathologist will help you with your swallowing during treatment. Continue to follow the swallowing safety guidelines. To swallow safely, sit up straight when eating or drinking, and remain sitting up for 30 minutes afterwards. Use teaspoons and take small sips of liquids. Alternate between small bites of food with small sips of liquids. Try not to talk while chewing or swallowing. And check that your mouth and cheeks are free from food after eating. You may be given other swallowing techniques to help you swallow as best you can. Follow the swallowing exercises provided by your speech-language pathologist. Continue with your exercises as best as you can through treatment. Do each exercise 5 to 10 times per exercise, 3 times a day. Anytime after the second week of treatment, you may find that swallowing is more difficult due to the side effects from radiation. These changes may continue until a few weeks after your treatment is complete. Your mouth or throat may feel like it is on fire when you swallow, and you may notice taste and smell changes. Your mouth may feel dry. Carry a bottle of water with you and sip often. Rinse with bland rinse. Your dental oncology team will help you with your mouth care during your treatment. Floss at least once daily if you're able. Use a topical anesthetic rinse prior to flossing if necessary. Use a topical anesthetic rinse before brushing. Use a soft toothbrush with a fluoride toothpaste and gently brush after meals and before bed. If you cannot bear toothpaste, use mouth rinse. To clear your mouth, use a wet cloth soaked in mouth rinse. When rinsing, rinse, swish, and spit. Rinse several times after brushing, flossing, and eating. Ensure medicated rinses are done 20 minutes apart. To make a bland mouth rinse, you will need 1 teaspoon of salt, 1 teaspoon of baking soda, and 4 cups of water. Mix 1 teaspoon of baking soda and 1 teaspoon of salt with 4 cups of water. Put the mouthwash in a container with a lid. Keep it room temperature and discard at the end of each day and make a new batch. Shake well before using. Rinse and gargle with 1 tablespoon and then spit out. Repeat 2 or 3 times at each use. And use mouthwash every 1 to 2 hours during the day. If you have dentures, keep them out as much as possible. Remove your dentures, plates, and prostheses before brushing. Brush and rinse dentures after meals and before bed, and soak them in cleansing solution for at least 8 hours. If you are on antifungal therapy, soak in antifungal solution. Directions for use of fluoride trays. Brush and floss before wearing tray. Fill the grooves of the tray 1/3 full with gel. Insert tray and spit out any excess gel. Leave the tray in for 5 minutes. Use at bedtime for longer-lasting results. Brush trays and air dry after each use. Do not use hot water to clean trays. Hot water will distort the tray. Do not eat, drink, or rinse for 30 minutes after tray use. Inform your dental team if you are no longer able to use your fluoride trays. Moisturize nasal passages through the night with a steam vaporizer in your room. Moisturize with mouth rinse and water-based lubricants often. Avoid petroleum jelly and glycerin products. To care for your lips, use water-soluble animal or plant-based oil lubricants. Do not apply petroleum jelly. Your radiation treatment team will help you with your skincare during treatment. Your skin may feel dry, tight, itchy, red, and swollen. Continue to care for your skin as previously advised by your radiation treatment team. Wash with mild, unscented soap. Bathe with warm water, rinse well, and pat dry with a clean, soft towel. Wear loose-fitting and breathable clothing such as cotton. Use water-based body lotions or creams to moisturize the skin as needed. Do not use aftershave or perfume products on your skin. Avoid products that contain petroleum jelly. Do not peel off loose skin, and do not scratch or rub your skin. Protect your skin from direct sunlight and wind. Wear a brimmed hat and protective clothing. Avoid extreme hot or cold temperatures. Do not use ice packs or heating pads, and do not soak in a hot tub. Use an electric shaver only. Tell your healthcare team if your skin opens or becomes wet or feels itchy. Continue to wash with mild soap and warm water and pat the area dry. Your doctor may prescribe a cream for your skin. You may use normal saline compresses up to 4 times a day. If you are having problems with your stoma, tell any member of your healthcare team. If you have a feeding tube, your registered dietitian, RD, and primary care team will work with you to manage your tube feeding and care. Continue to flush your feeding tube with water 2 times per day, morning and night, with 60 milliliters or 1 syringe of room temperature tap water. If you are losing weight or eating and drinking less food and fluid by mouth, your RD will continue to work with you to start and monitor tube feeds. Use water and nutrition supplements following your registered dietitian's advice. To care for your tube, clean the skin around your tube daily and keep it dry. Clean the skin with a cotton swab dipped in water or gentle soap and water. Wipe away any crusting or drainage. Gently pat dry with a soft, clean towel or cotton ball. If there is a leak, cover skin with a gauze bandage. If there is no discharge, stop using a dressing. Check tube for redness, tenderness, a bad smell, or signs of infection. Signs of infections include fiery red, swollen, discharge, pain, or fever. Cover tube while showering. No baths, hot tubs, or pools. Do not use rubbing alcohol, peroxide, antibacterial lotions, or gels on the skin around your tube. Tell your healthcare team if you think you have an infection or any issues with your tube, or if the bumper seems too tight or too loose.